Well, the transition from summer to fall can stimulate triggers in people who have asthma. London Drugs Pharmacist Chelsea Kwong joins me now with more details and solutions on how to handle the condition. Good morning, Chelsea.
Hi, good morning.
I feel like many people either have experienced or know someone who has asthma, but what exactly is the condition?
So, asthma is a chronic inflammatory disease of the airways that causes symptoms like shortness of breath, chest tightness, coughing, and wheezing. Asthma causes the inflammation and narrowing of the bronchial tubes, which leads to limited airflow and difficulty breathing. The airways of our lungs are surrounded by muscles and contain mucus glands, and these muscles are normally relaxed. But if you have asthma, they're often sensitive and inflamed. When people with asthma encounter triggers, these muscles react by tightening even more, the lining of the airways swell, and the airways can fill up with mucus. This makes breathing very difficult and leads to either asthma symptoms or an asthma attack.
Well, let's talk about some of those triggers, Chelsea. What would they be when it comes to asthma?
So, a trigger can be anything that irritates your airways. Asthma is caused by two types of triggers: allergic and non allergic. Allergic triggers cause allergic reactions and include things like dust mites, pollen, molds, and pet dander. Non allergic triggers are usually airway irritants like smoke, cold air pollutants, and even intense emotions and exercise.
And then what would some of the symptoms be associated with it?
So, asthma can be different for everyone, and the symptoms can also vary over time, with few or no symptoms when asthma is well controlled. Some of the common signs and symptoms of poorly controlled asthma include that shortness of breath or chest tightness, regular coughing and wheezing, increased mucus production, and even trouble sleeping or being able to take part in physical activities because of that difficulty breathing. However, in children with asthma, the symptoms may vary widely. Coughing is commonly the only symptom that they have. Some will cough all night but are symptom free during the day, while others seem to get frequent chest colds that just won't go away.
And of course, with a condition like this, pharmacists are really helpful when it comes to managing it for yourself or for your child.
Yeah, so like you said, your pharmacist can be a big help to those who have asthma. Pharmacists can help you to develop an asthma action plan so they can help to explain triggers to watch out for and how to manage them, and can determine the right course of action if you do have an asthma attack. So they can help you plan when to seek medical attention or when to use medications to treat your symptoms. Pharmacists are also a great resource for explaining proper inhaler technique, planning when to use either rescue or maintenance inhalers, and can show you how to use devices such as spacers with your inhaler.
Awesome. Thanks so much for this, Chelsea. Lots of great information here.
Yeah, you're welcome.
And as a reminder, please talk to your healthcare provider before making any healthcare decisions or for guidance about a specific medical condition. For more information, visit London Drugs website.